Let's bring in the director at the NHS Confederation, Dr. Layla McCay. Hello, Layla.
Hello.
So first of all, the saliva test, how significant is that, do you think?
Well, if it comes off, it will be really quite significant in two main ways. One, it makes it much easier to do the test, so more people will probably be happy to do that. And two, the results coming back more quickly will be really helpful because as soon as you've got a positive result, you can activate the test and trace system, you can find the contacts, you can get people isolated sooner, which hopefully means reducing transmission. So it is a significant development in the efforts to reduce cases of coronavirus.
The Health Secretary is still not able to put a date on when mass testing may be rolled out nationwide. What do you think?
Well, it's interesting, isn't it, to hear these promises of mass testing on the same day as we're hearing that actually we don't seem to have enough tests for people with symptoms within the local area where they live. So I think that it will be really interesting to see how this comes out. But what is clear is that we very clearly do need more investment in testing to make sure that people who need a test can get a test.
There's a testing centre not very far from where I'm sitting, and I'm told that most days it's fairly quiet. People aren't using them in Cambridgeshire.
Well, at the end of the day, if people need a test, then my advice would be to go and get that test. If you have the symptoms, then, find out whether you've got coronavirus, activate the test and trace system so that your contacts can be found and so that they can be given the right advice. Obviously, issues like today where people are having difficulty getting local tests, hopefully that is a temporary situation that will be resolved. But at the end of the day, the only way to really identify and nip potential outbreaks in the bud is to get the testing done and understand where those cases are.
Matt Hancock says the system works well at the moment. Do you agree with that?
Well, the system is working to some extent, but I think that we're hearing from our members across the NHS that there are still concerns. In particular, not everyone who's testing positive is actually being passed over to the test and trace system so that they can find the contacts. And of the people that give contacts, not that many people are actually being found and contacted and given the right advice, whether that's to isolate or whatever. And rather than that improving, in fact, this week it looked like it was going down a bit. So I think that a lot of people have some concerns about how this system needs to evolve and improve if we're all to have confidence going into winter.
Mr. Hancock also boasts that over the past 6 months, these are his words, we have built almost from scratch one of the biggest testing systems in the world. Do you think they've done it the right way by involving private companies rather than just have it from within the NHS?
Well, I think it's too early to really understand what the rights and wrongs of any situation are, but certainly what we're hearing from members is that involving the local systems as much as possible is delivering a most effective way of reaching people. And really, when it's at these huge scales that may exceed the capacity of local people, then really working together between the national and local is going to be what's needed to make the difference and get the system working as well as possible.
And final question, Layla. Money's been thrown at this, billions of pounds. Has it all been wisely spent?
Again, it's too early to say. I think it is clear that if we want to have an effective test and trace system, then money does have to be spent, and that money is being spent. As to the success of it, we're seeing other countries are taking all sorts of different approaches, but the jury's still out. It's too early to say.
Layla, thank you so much. Dr. Layla McCay there, Director at the NHS Confederation.